lives, reduce the burden on hospitals, and allow movement of people for commerce, education, and quality of life.
Governor Asa Hutchinson and state health leaders remain firm on their mission to curb the spread of the coronavirus across the state. Good evening and thanks for joining us. For Fox 16 News, I'm Kevin Kelly.
I'm Donna Terrell. In the last 24 hours, Arkansas has recorded 794 new cases of COVID-19. So now there are 6,558 active cases across the state. There are currently 445 people in the hospital, and as of today, 22,844 people have recovered. 331 people have died from COVID-19. Our Haley Brooks was at the governor's daily briefing and updates us tonight on testing and contact tracing.
Today, Governor Hutchinson talked a lot about testing numbers and contact tracing, saying the only way to reach our goal of slowing the spread is to continue upping these numbers.
But one of the key elements to be successful in that strategy is testing.
In Tuesday's daily COVID-19 briefing, Governor Hutchinson said in the last 24 hours, more than 6,000 people have been tested for COVID-19.
That level of testing is critical for us as we go into the fall, as we look for continued activities in the state.
Dr. Nate Smith also commented on testing, saying the public health lab has set some records in the last few days.
For the last 3 days, each of those days, we've tested more than we tested in the entire month of March.
Contact tracing was also highly discussed. Arkansas Department of Health Chief of Staff Stephanie Williams said they're in the final stages of adding a second vendor for contact tracing with hundreds of employees. Plus, the existing contract we have with General Dynamics is ramping up their contact tracing staff too.
They had 83 staff already hired, and then they had another, I think, about 1,200 applicants.
Governor Hutchinson said testing numbers like this and contact tracing is the only way we're going to reach our goals.
And our goal is to save lives, reduce the burden on hospitals, and allow movement of people for commerce, education, and quality of life.
Dr. Smith said the public health lab is going to continue doing more testing and picking up the slack in the natural state. Reporting in Little Rock, I'm Haley Brooks. Back to you.